Welcome to Trial by Wine. We take a closer look at crimes that highlight how fascinating humans can be. Schmidty, Swanee and Clarkey visit crimes and run them through their jury of three, debating both sides of the case to agree an appropriate, if totally fictitious, sentence. Please be advised, Trial by Wine may include explicit or disturbing content and will include drunken rambling. Listener discretion is advised.
All right, how are we?
Very well, thanks. Good to see your faces.
It's nice to see you both, all three of you actually.
You know, Swanee's looking a bit upset because she doesn't get my off-the-shoulder collection because I survived my surgery. So I know she's going to be upset about that, but you'll just have to wait.
She did send me a message saying at which point would it, like how long after surgery
Do I have to wait?
is it too late before people will start to suspect that it wasn't the surgery that killed her? Just in case you wanted to fly over and just
What do you think the window is?
job.
I think you've missed your opportunity on that one because I'm pretty hale and hearty now. So I reckon within the first few days, but I was just lying in bed, so I didn't really have nothing's happened. It's all been good. It's all gone according to plan. So
How long were you in hospital for?
3 nights, 4
too
days.
fucking long.
Oh, okay, that's
A bit longer than I expected, yeah. I had very low blood pressure, and so they were waiting to make sure that had leveled out, and it did. It was fine. And then they kept me in an extra day, and I think it was just around the blood pressure.
Make sure you weren't leaking.
Well, because my sister, this is, I like to talk about my bowels. My sister was surprised they let me go because I hadn't gone to the toilet. I hadn't evacuated. And I'd had to do a 24-hour fast beforehand as well. And I hadn't actually gone to the toilet for days before. So the first time I went to the toilet it was almost 7 days, I think, between one poop and another.
Jesus.
With all the drugs.
Were your eyeballs going brown?
It was a horrendous experience. I had the sweats. I was in so much pain. It was awful. And because, of course, they can't push or anything, or not that you anyway, but the position you're in, because the toilet, I'm on a raised toilet seat as well, so you're not even in a prime pooing position. Far out. It was worse than the hip surgery. It was just dreadful. But anyway.
The poo couldn't find the hole to get out.
No. And the hole was just really tight, and it was like, I'm not letting anything past. That you shall not pass. That was my sphincter. And my sister was in the other room watching Bridgerton, giggling away while I'm there fanning myself, trying not to faint. Oh, it was awful. Absolutely awful. Anyway, that's sorted itself out since. So I haven't had too bad a
I don't think
time
there's enough.
since then.
Well, not that it's not enough, but yeah, I think it's a lot of people have had that experience post-surgery when you just go,
and they keep giving
I can't that stuff you up. Or whatever.
Awful.
It's got to come out one way.
And they kept giving me stool softeners and laxatives in the hospital.
Yeah.
And it still took a day, another 24 hours before it really worked. And when it worked, but oh my goodness. And I had such a corker, it just didn't want to come out. But I got there in the end, but it was awful. Awful. Yeah.
What a lovely chat.
There you go.
Is anyone still listening?
That may or may not stay in, unlike my poo. Anyway, other than me recovering from surgery, is there any other news from you guys? What have you been up to? Swanee, you had a bit of a trip away.
Oh, yes, I took my mother to Hawaii for her 80th birthday. That was very nice with my brother. And we had...
It looked like you had a wonderful time.
Yeah, it was very nice. Cannot complain. It was lovely. It feels like a while ago now. I suppose I must have flown out about a month ago. So
it was.
Yeah, that'd be right for your operation was a month ago, was it?
Yes.
Yeah. Well, there you go. Oh, dudes, what about you, boys? What have you been up to? Hip replacements,
I can't think of
holidays?
anything exciting. Yeah, none of that. No. Just heads down, bum up, trying to get through, the
life,
working week and, the shit show that is life.
Oh.
I suppose we should introduce ourselves. I'm Schmidty.
I'm Swanee.
And I'm Clarkey. And together we are
Trial by
Wine.
And then what are we drinking, if anything?
I forgot to get a drink.
Boys?
What? We're on the Soda Stream and Lemon.
Oh, nice.
Oh,
I'm just on water. I've just got plain water because I am on a lot of drugs.
At us.
Oh, my God. That
Bunch of
must
alcoholics.
be our worst lineup ever. And I'm always the lowest common denominator, but jeepers.
It is bad, isn't it?
Should I get a
we
Diet
could change
Coke?
this episode to Trial by Endone.
I might go get a fridge ciggy.
Pentadol.
I reckon I'll get a fridge ciggy.
Get a fridge ciggy.
Yeah, do it.
And I'll tell you what I'm on. It'll be Trial by. Now I'll just get into my drug drawer. What have we got here? Trial by Palexia SR.
I had them.
Slow release.
Slow release. And so that's my one in the morning, one at night. And then
That's what I had for my shoulder.
Your 4-hour one.
my 4-hour one, which is actually says
Fuck you up a doll.
it's the same thing. It's tapentadol, but it's
The fast release.
6 hours. It
fast
says,
acting.
it's the IR immediate release,
Yeah.
and it says every 6 hours for that one, which I took one today. I haven't, and I didn't have any yesterday because I'm trying to get off them a bit.
Wean yourself off.
And I had a couple of osteomols, just padadols.
Osteomoles.
Osteomol.
They're not really called osteomoles, are they?
Osteomol.
fuck
Yeah,
is
they
that?
are. I think they are.
No, they're not.
Osteomol. They are. They're called osteomol.
Trial by osteomol.
Oh,
And
nice.
Celebrex as well.
Oh, we've got a bit of Celebrex. Alex had that. I could have gone and got a Celebrex. And I've got an
Anti-inflammatory.
old school
Is that
original DC
Oh.
today.
And
fridge
then
ciggy?
at
Fantastic.
8:30 tonight, I've got to take a Revoxa,
What's
which is
that?
a blood thinner. Because
All
I'm
right.
not moving very much, it's stopping me get DVT.
Is Celebrex a party drug?
No, it's a
Just
Anti-inflammatory.
sounds like
Anti-inflammatory.
it. Yeah, like celebrate.
Celebrate,
you
yeah.
know.
Celebrex tonight.
Times
Come on.
Come on. We're going to have a good time tonight. Let's
Celebrex.
celebrate.
Probably more.
It's
But
all
it's all
right.
And if I was in severe pain, which I'm not, so I'm not taking these, but I do have a packet then of your favourite oxycodone. There you go. All right, so you've got a fridge ciggy. I'm
I
on
have.
water and the boys are on
And I did remember
lemony
that when
water.
I was in Hawaii, I did send you a little image of what was this perfect Diet Coke
Oh,
setup.
in the plastic cup.
Yeah, oh no, it wasn't a
Mm.
plastic cup, but it was on a
Oh.
beach with the orchid in top.
That's right.
And it had lots of ice. It was that like maybe the first or second, no, it wasn't even the second day. It was a few days in where someone said, oh, and don't forget you've got unlimited refills. And I was like, I forget that that's a concept in the US,
What?
right? And
Yep.
for soft drinks.
Yeah.
And I was like, oh, I'd forgotten that. It's been a while since I've been here. And then after that, I was like, righty-o. You know, it was like,
So were
probably-
you just ODing on caffeine the entire time you were there?
well, I did have a little bit, to
A
be
little
fair.
bit.
Like, I mean,
Yeah.
and we weren't, Mum and I were like not eating in the day. Like, we were just living on Diet Cokes on the beach and then having like some meals that were massive and then having like something in the afternoon. But yeah, it was definitely a DC day out on the beach.
I mean, if you just threw in a pack of Durries, it would have been our previous
would have been
holiday
old school.
experience. Yeah.
And
yeah.
I did buy quite a few cigarettes actually whilst I was there. I was going to like the little convenience stores or whatever going, now what have you got that's like long and slender and nice packaging because it's still got the outer packaging over there? And, you know, we've got a party coming out. I was like, can I have a look at that? And like, it doesn't say what milligrams it's got and how strong. So I've got a bit of menthol, something called Capri's. I've got
Oh,
a few
yes.
little things. Yeah.
I like an ultra slim too. But anyway,
Yes.
I'm off. I haven't had a cigarette for over a year now, and
I know.
will continue to be a complete giver-upper. I'm a quitter on that one, and I'm
Well
okay
done,
with that.
you.
Yeah. I suppose I should tell us a story. Do you want to hear a story?
Yes, please.
Go on then.
Love to.
All right. So my inspiration for today's case comes from a pre-surgery chat that I had with the anaesthetic nurse.
Oh.
So
No.
what happened was my surgeon was a bit late. Oh, what have you got there?
I just
The
forgot.
biggest-
I bought myself a little treat.
A little
Yes.
packet of
A
highlights.
rainbow of highlighters.
I forgot I'd bought them. I've just opened up my little thing that I like to doodle and put my notes in. And I forgot that I'd
And you
got
got to
myself
highlight it.
a little treat for trial by
Nice.
wine. Right. So what were you and the anaesthetist talking about?
Well, so what happened was the surgeon was a bit late. So he was doing a surgery somewhere else on someone else. And I was due to go in at 9:30 and I went in at 9:30 and we were all hanging around, but the prof didn't show up till about, I think, 10:15, 10:20.
Oh.
So that's all right.
Did you say something?
No. Well, I
This
wasn't
joint's
bothered.
fucked.
Oh, good of you to come.
And what do you call this?
They had me all prepped and whatever, and I was like, can I go to the toilet? So I went and had a wee at one point because I said to her, they gave me a spinal block, and I was like, I don't want to wet myself. So she's like, yeah, no, and it does happen. So I went off and did a wee-wees before we started. Yeah, I mean, I had it all. I had a spinal block. I had a full
Sounds like you've
general
had a
anaesthetic.
baby.
No, it wasn't
Especially
an
the poo-
epidural. It was a little different. And he went to pains to tell me the difference. But anyway, before that happened,
I wouldn't know.
I was hanging around with this woman just outside the operating theatre, and we were just shooting the breeze because, but they were talking about a podcast. So I got the impression they've worked together before, but not recently. And so he said something like, oh, hi, how you going? And she said, yeah, the last time we spoke, he had recommended a podcast to her. And I can't remember the name of that one.
And then you went, calm down, calm down. I'll give you an autograph later. At the moment, this is just private time for me. If you're going to get all funny on me, if you're going to get all funny with me, can we just wait until after surgery? Yes, I'll happily give you an interview and autograph later.
Not quite. But I did say, tell me more, tell me more. I've got a true crime podcast. And, I always like to get a bit of inspo and, hear some stories. So she told me about the story that I'm going to cover today. And given I was about to go under the knife, it might seem a bit of an odd thing that I was talking about this, but as you know, I'd made my peace with God, and that all my morbid curiosity got the better of me one way or the other. Either way, I'm dedicating this story to the anaesthetic nurse who was an absolute legend, and unfortunately I can't remember her name because I was a little bit anxious quietly. We also had a little conversation about how often people died on the operating table.
Oh, good pre-chat.
Do you remember that?
Because what I was talking about was the same thing I said to you guys, which is I've made peace with it because if you put me to sleep and I don't wake up, I won't know, So we had a bit of a chat about that.
Caroline.
Oh, well, because I was a little anxious. Anyway.
It's a good way to go. If you're going to go.
I think it's the best way. There's no suffering. You're just literally asleep. And honestly, he comes in and he gives me a shot of something. Oh, he'd done the catheter in the is it a catheter or a cannula, whatever it is? Cannula. In my, not a catheter, cannula.
Definitely cannula.
Popped that in my hand. And then he came in and he did the whole little joke going, here, have a little voddy and lime or whatever. And he's pushing drugs into the line. And I was like, oh, yeah, there's that voddy. You have
to do stronger than that.
Woo! No, it was pretty strong. And then they did the spinal block. And I don't really remember anything after that. I know that they laid me on the table and stuff, but I don't remember any of it. Woke up and it was all good. Anyway, so it shouldn't come as a surprise that this story is about medical malfeasance.
Medical what?
Malfeasance.
I don't know that word.
Malfeasance.
I know.
Sound like that.
Gosh.
It sounds like it, but it's
Is
malfeasance.
it different to malpractice? What does it mean?
It means the same as malpractice, but it sounds like feces, which is why I chose to use it.
Well, it worked. Got my
What a shit of a name.
My sources are Wikipedia, Time Magazine, ProPublica, D Magazine, a Peacock series called Dr. Death, Texas True Crime Blog, WalshMedicalMedia.com, and court transcripts.
That's not Brian Walsh, is it? Was it an Australian thing or is it foreign?
No, I think it's American.
Okay.
You're missing all the classics in there. Just,
Yeah.
What did Lad Bible have to say about this story?
I didn't get anything from Lad Bible.
We haven't done a good Lad Bible one for a while.
True.
Anyway,
I haven't, no oxygen, no all that's interesting, no.
All that's interesting.
Not even Murderpedia.
Yep.
So here we go.
Murderpedia.
Now, whilst I'm a weirdo who was casually chatting about medical malpractice and deaths in surgery just before being knocked out for my own joint replacement, the underlying reason I could do that without being a blubbering mess was because I trust my surgeon. You assume when you meet a medical specialist that they've done years and years of training and are super experienced, and therefore they must know what they're doing and talking about. They're surrounded by other doctors and nurses who, if they were a disaster, would report them, wouldn't they? You assume this almost inherently, yes, when you enter their offices.
Yeah.
Then you get to know them a little, and their manner also reassures you, or it can put you off and you end up going looking for another doctor. The point is, what do you really know about a doctor when you put your life in their hands? Mostly you just assume that they're good, and you know what I say about assuming. Never assume. It makes a dickhead out of both of us. But
Doesn't it make an arse out of you and me?
It does. But
How do you spell assume?
for about the past 25 years, since I kept saying never assume to a colleague of mine at Foxtel, and one day I said to her, what do I say about assumption? Never assume. She goes, I know, it makes a dickhead out of both of us. She had never picked up on the wordplay. She didn't get it. So from then
Was
on.
that somebody that I know?
Or that I know?
You
I'm
might
listening
know
to
her,
what you're
Shay.
hearing.
No, it wasn't her. No. And at the time, we laughed heartily when I explained it to her, and she was like, oh, what a dickhead I am. But ever since then, I've always said it makes a dickhead out of both of us. Anyway, but we want to trust them too. And, you don't go to a surgeon for shits and giggles. You
Can't shit?
Well,
or you can't
you
giggle?
don't contemplate a massively
Depression
invasive
and constipation.
Yeah, you don't contemplate a massively invasive removal and replacement of a part of yourself just to see how it feels, You're in pain.
You do generally think they've got a clue.
True. You're in pain. You're in pain all the time. Point is, a person who goes to see a surgeon to have something fixed has a problem and it's chronic and they're in pain and they're vulnerable also.
And believes that person can fix it.
That's right. So, and I did, just say, from my own experience, I did do some research on my surgeon before the first time I went to him.
What, to see how many people he'd murdered?
No, well, I mean, yes.
Google Dr. Death.
But I looked into him, and he teaches his specialism at Melbourne Uni. He's got a very long career, and so I thought that's okay. He looks all right on paper as well as in person.
I'll give it a shot.
And it turns out he is an excellent surgeon, but you never can tell.
What could go wrong?
And this
I do
story
think you fangirl him. I think you really love him.
I love
you're
my
very
prof.
impressed what he did to you last week.
I love my prof.
Yeah, she's got the hots for him.
I like it. Like, I mean, you're definitely an advocate, and I think maybe it had such
I'm a big fan of his. Yeah,
impact on your life. I think it's quite lovely.
Once
took
this
away
is all
my
done,
pain.
can we bump hips?
No, not like that. But
sorry,
side on maybe.
He's an attractive man, by the way. But I do not want to bump hips with him, side on or otherwise. No, but he's a really good surgeon, right? Anyway, this story will show you that you can't really tell whether a surgeon is what they're making themselves out to be.
Oh, great.
Yeah. So I'm going to talk to you about
Fab.
No, I'm scared.
Christopher Duntsch.
Is he Dr. Death, is he?
He is Dr. Death, yes.
I have looked to do this before, but never done it.
Christopher Daniel Duntsch was born in Montana in 1970. Duntsch. D-U-N-T-S-C-H. Duntsch.
German, Dutch.
Duntsch.
Polish,
Probably
was it?
Dutch, maybe? Yeah,
One too many N's to be Dutch.
Is it?
Is there no N?
Oh, yeah.
True.
Well, makes a dickhead out of both of us.
That was a good one. Took me a moment to get it, but it was a good one. I got it eventually, yes. He grew up in Montana and then he went to Tennessee, grew up predominantly in Tennessee. His father was a physical therapist and his mother was employed as a school teacher. People who knew him during childhood and adolescence would describe him as intensely competitive, almost obsessively driven towards success, regardless of whether his natural ability actually supported his ambitions.
Wow.
Yeah. He was not the best at sports, but his persistence and refusal to acknowledge that he wasn't that good really stood out to his peers. He had a relentless self-belief. Now,
clueless?
Yeah.
Full of himself? Combination of both?
Extremely full of himself. No, he was allegedly quite brilliant. Now, I've always had plenty of self-confidence, and some would say too much. And some people said to me before, you're good at everything you do. And it's not true because I only do the things I am good at. I don't, if I do something that I'm not good at, I don't do it anymore.
You're not wrong.
Yeah, but I'm not good at everything.
But I am humble enough to tell you I'm only doing the things I'm really brilliant at.
I'm also very selective.
Why would I do things that I'm shit at all the time, right? But this guy basically didn't have the ability to recognise when he was shit at something and stop it. He just told himself and the world that he was awesome, and he certainly seemed to believe it.
I can do that.
Absolutely. Oh, yeah, no, I'm great. I'm great, mate. He eventually entered the University of Tennessee Health Science Center, enrolling in a combined MD, PhD program, and academically, as I say, he was considered quite brilliant. However...
So he earned his way there, so he's not a dummy.
No, he's no dummy, and I'll keep telling the story.
Is this a story about the difference between theory and practice?
A bit, yeah. So, however, word on the street was that when he was in his residencies that he was on drugs throughout his training. Allegedly, he was taking coke, LSD, and other drugs, and would remain awake.
Is that you?
Yeah, don't worry about it.
That was kind of the attitude from some of his peers. But he would remain awake all night using the drugs before calmly presenting himself for medical responsibilities the next morning.
Oh.
And one of his mates and peers at the time said he'd never let them operate on him. And then someone else anonymously reported him as being on drugs because they were concerned, and he was asked to attend a program for impaired physicians in his 4th year of residency.
That's pretty early on.
Yeah.
Impaired physicians.
Yeah. Apparently there's
a program.
Well,
it's a real issue, isn't it? I've done
I was going to say, I think it's a thing. I don't think it was just him.
It's a massive issue. They often will refer to it with nurses who access different things, but
It's access
less
to
to an extent with
prescription
doctors.
drugs and things.
But I did a story once, can't remember it, but I know I did.
Yeah.
About a doctor who was
He got
like
struck off
literally.
in the end.
Yeah.
He can't remember. He's the one who ended up trading body parts.
I think it was him, yes.
Yeah. So, but it is an
so
issue.
impaired physicians, is it because they're prescribing their own drugs, or just because they're having a good old time at uni?
If you're just doing
I'm
drugs.
intrigued about that.
I think he was prescribing drugs. He got a reputation for being the person to go to if you wanted some as well. And he was taking them. He was enjoying them. He was also enjoying stuff that wasn't prescription, LSD and cocaine.
Dr. Drugs.
Liked a bit of coke.
All going on.
Yeah. And so he went on this program, and then he was signed off as being all right.
So here you go. An impaired physician is a medical professional whose ability to safely perform their clinical duties is compromised by physical illness, mental health conditions like depression, or substance abuse.
Yep.
There you go.
And I think the substance abuse is more common than... It's a very high stress thing. I've watched ER. They work all those hours, and they're doing, often they've got no money, and they're, paying all their
patients
uni
are all
bills,
whining about,
and they're in the ER, and it's hard work. So yes, I'm sure
blood everywhere,
a lot of stress. That's right. So anyway, it's all alleged, and so whether he was using drugs or not, he did seem to push the envelope though in terms of acting out of his delegation. The Peacock series, which had Alec Baldwin and Christian Slater, who are the hero doctors, and Joshua Jackson, who you may recall from Dawson's Creek fame, or the Mighty Ducks. Yes.
Pacey.
Well, he's Christian. He's Christopher Duntsch in the TV series. Now that TV series is very good, but it is slightly fictionalized in parts. It's dramatized. Is based on the true story though. And Chris, I thought, by the way, that Pacey was very flattering casting.
Who's Chris? That's a very casual approach.
Chris Duntsch is...
It sounds like you know him now. Oh,
Dr. Chris. Yeah. Dr. Chris
Me
is...
and Dr. Death are on a first-name basis.
Primary subject.
That really softens it. Does it Dr. Death to Chris?
Chris, yes. Well, he's not Dr. Death at this point. He's just Chris. And, when Pacey was depicting Chris in a scene where he's telling a patient he could fix her spinal issues. So basically the way they portrayed him overstepping his boundaries was he was like a ex-year resident, and he's saying to this woman, oh, yeah, don't worry, we're just going to do this thing, or we'll take a disc out, we'll fuse that, and it's all fine, and there'll be no problem. And the actual proper doctor who was observing him took him aside and said, you've just promised her something that we can't do because of her medical background. She's got too many complications. We wouldn't be able to do that surgery. Yeah. And you're not a qualified surgeon, and you shouldn't be doing that. And he's like, mate, I'm fine. I know what I'm doing. Whatevs. So that was pretty much how they...
What would you know?
No, it's fine. Not only thinking that he was the best at everything, but also very much happy to break the rules, very happy to step outside of the boundaries that are there for a good reason. Now, neurosurgery is one of the longest and most grueling pathways in medicine.
Good.
Residents spend years operating under direct supervision while gradually building competence and technical precision. Later investigations suggested that Chris may have completed around 200 surgeries independently during residency, compared with what many experts consider normal for someone entering an autonomous practice, which would be around the 1,000 mark.
Oh, so he
did a lot less. He did a lot less supervised.
I thought you were saying he was doing them on the side whilst he was going through uni for a minute.
No, he was operating with supervision.
Yeah, I've just got to pay my bills somehow. It's that or OnlyFans.
But he only did 200 in that period when he should have done more like 1,000 before he went out to have his own practice.
Is that because he was so good? He learnt 5 times quicker?
No. And there's a question about whether or not the doctors who supervised him actually did think he was that good at what he was doing. But he got a satisfactory mark from everyone, right?
Is there a question on the university that allows someone to do that much less than everybody else and still graduate?
Absolutely there is, yes.
Good. Okay.
So back to
the story.
Yeah, underlining that whole point about trust and assumptions. You assume when you're going to be operated on that the person who's operating on you has met all of those minimum requirements and has been signed off by someone who's not going to let them out into the wild if they haven't got that competency.
Yes, and hopefully done more than just the minimum requirements. Like you don't
Correct.
don't
Yeah,
want to be someone's first outside of uni.
you absolutely do not.
How
in
many of
this
these have
case.
you done before? None.
Correct. And also, modern healthcare actually depends heavily on credentialing systems. Hospitals trust residency programs to identify unsafe physicians. Patients trust hospitals to verify competence. This case exposed what can happen when those assumptions fail repeatedly. So
Do you think there might be a situation, you know how you said he got satisfactory? Do you think sometimes where something might happen like that and everyone's like, oh, that wasn't great, but someone else will pick it up if he's not good, or some other doctor will. And if they're all kind of thinking the same kind of thing, instead of just scraping by.
like the bystander syndrome.
Yeah, or just sort of.
There's a bit of that, but I think I haven't really gone into it in the body of the rest of the story, but
Yeah.
he was doing a fellowship at the same time. He was doing a piece of research, he was a research fellow.
Right.
And he was researching the use of stem cells to reverse cancer, basically.
Right.
The idea that if cancer can mutate into something else, by utilizing stem cells, you can mutate it back, kind of thing. And the man who was, and I can't remember the name of him, but the man who was in charge of that fellowship was also his overall supervising doctor
Yeah.
at the university. And I believe that, yes, that would have been a bit of a conflict of interest, because he also there were a series of companies that had invested in the fellowship and were looking for, this sort of idea to then invest
Yep.
in and create money out of, right? And so there's a suggestion that there's a conflict of interest, that the guy who had signed him off and let him go and do research work instead of when he was supposed to be doing
All right.
operations and things.
Yeah.
So he was diverted onto the fellowship work more than his surgical rotations, etc.
Yeah.
That's pretty much how the defence tried to play it in the end, but because there was skin in the game for them, and it behooved them to have him doing all that research, because he was apparently, as a researcher, brilliant. Yeah.
Okay.
As a surgeon.
Not so much, as we're about to hear. So by 2011, Chris arrived in Dallas, marketing himself as an elite, minimally invasive spine surgeon. He projected enormous confidence. He spoke aggressively about innovation and expertise. Patients suffering chronic spinal pain are often profoundly vulnerable because of long-term pain, and it destroys nearly every aspect of their life. Many become desperate after years of failed treatment. Chris offered certainty, optimism, and the promise of transformation, and the hospitals lapped it up too. So the other thing is, he's out there, and I suppose it works like this for our system too. I'm not really that across it, but as a neurosurgeon, he can make a lot of money for a hospital, because I assume what happens is he gets the patient who needs it, he goes into a certain hospital, he does the operation, and the hospital gains cash from those operations. So he was able to obtain privileges at several institutions, including Baylor Regional Medical Center, which in Plano, which is was a very high-end medical center, and university.
What do you mean by privileges?
Privileges means he's allowed to operate there.
Okay.
So my surgeon, for instance,
Not like the
operates.
assorted creams instead of just the
Just
dodgy
the plain
biscuits.
Yeah, that's right.
Yeah.
No, so my surgeon operates out of Epworth and St. Vincent's Private. It's the same sort of thing. He has his own suite of consulting suite that I go to see him initially, but then all the surgery and all the staff and all the rest are under the hospital. So I think it's sort of similar, that the hospital makes money, therefore, out of my surgeon. He makes money, but so do they. Yeah, so he had privileges at Baylor, Dallas Medical Center, and University General Hospital, but almost immediately...
General Hospital.
I know, but almost immediately things were going wrong in the operating theatre. His first surgery at Baylor resulted in Chris operating on the wrong part of a patient's back.
How far apart are we talking?
This is his first surgery in Dallas.
No, but I mean, like on the wrong part of the back.
Is it C5?
Not
the fifth and the sixth, or was it?
I'm not 100% sure.
Ruler away.
What year is this, Schmidty?
2011.
Okay.
So after botching that job, he did a second surgery on the guy and left him paralysed in his legs.
Oh, my beer.
I don't like this story.
The patient, Kenneth Fennell, had to do months of rehab to be able to walk with a cane, and was left unable to walk for more than 10 metres or stand for more than a few minutes.
Sounds like someone I know.
He then operated on Lee Passmore, a Collin County medical investigator who was left with chronic pain and limited mobility because Chris had cut a ligament that he shouldn't have gone near and incorrectly put a screw in the wrong place, and it stripped its thread so it couldn't be removed, which turns out that even though it shouldn't have been there in the first place, it was good that you couldn't remove it, because if you had, the man would have bled to death. Then
Jesus.
Barry...
And sorry, are those two are different hospitals, different medical centres?
No, I think this was at Baylor. Then Barry Morgoloff ended up in a wheelchair due to the damage he did pulling a damaged disc out with a grabbing tool. He also refused to give Barry pain meds as he thought he was a drug seeker, even though he'd ripped out one of his discs and caused him all this pain.
A drug seeker.
And in a couple of these cases, the attending nurses and other staff noted that there was a lot of blood loss, and he didn't even seem to notice or care. Like he sponged it up, but it didn't faze him.
This is awful.
It shouldn't have been any blood, or that much.
I feel like anybody who is in that much pain should be a drug seeker, and you shouldn't say to somebody, I know you're in pain, but no.
Drug seeker.
You can't have
sounds
any
like
drug seeker.
Stretcher. A drug seeker.
It's in the same family, isn't it?
Is there something awkward about the two words put together? A drug seeker. It's like
not a drug stretcher.
Yeah.
Then he operated on Kelly Martin in 2012. He allegedly severed her vertebral artery, which caused enormous bleeding. And I read an article from D Magazine where they interviewed the surgery tech Anson Fulton, who was there at the time and who repeatedly told Chris she was losing too much blood, and he was told to shut up and mind his own business. It wasn't until about half an hour into this blood loss that other attending staff and Chris seemed to notice, but by then she'd lost so much blood she went into cardiac arrest. They were able to revive her, but she died later in the ICU, where she'd been taken after Chris had botched her surgery so badly. That's
his first death?
Is he having any successful surgeries in this period?
That's what I was going to ask, yeah.
Or is it all bad?
It's all bad.
Oh.
These are consecutive. There's nothing good in between.
No, these aren't all consecutive. There is bad in between. I haven't named... I'm not going to go through the 38 cases.
Oh, please
so, but is there any good ones?
Any successful
ones? 38 bad cases and 12 good ones or anything? It's just...
Yeah. What every single one's done.
In every single case, the patient died or was left worse off than
How long did this go on for?
Well, let me tell you the story and we'll get...
Please do. I just don't.
Carla wants to go straight to sentencing.
She does. Bang. That was the world's quickest trial by
I actually just want to avoid...
I'm done. Guilty.
The gore and people's backs being chopped makes me feel sick.
That's why I haven't told you the whole 38,
Please
don't, right?
Yeah.
So, but this poor woman didn't make it, and then this surgical technician, Anson, is quoted, he's still very scarred by the events he witnessed that day, and he's quoted saying, anytime I talk about it, I'm depressed for a couple of days afterwards. It never gets old. It's like it just happened yesterday, because I watched someone get murdered in front of my eyes, basically. That doesn't go away.
That is awful.
Yeah.
That is awful.
Even experienced surgeons familiar with the risks of spinal surgery were horrified reviewing the case. Damaging the vertebral artery is among the most feared complications in cervical spine operations because of how rapidly it can become fatal. Yet, despite the severity of what occurred, Chris continued operating. Well, what he did the entire time was blame someone else. Blame someone else. It was the anesthesiologist, the ICU killed that woman. We had her back. She was all right. He just at no point thought, well, I did that. I created that situation. Ever. Not once. In his mind, I think this is part of his psychopathy, he made it. He was very confident that it was someone else's fault, not his. Then another patient, Floella Brown, underwent spinal surgery expecting relief from chronic back pain. Instead, she awoke permanently disabled and suffering ongoing pain. Chris removed bone unnecessarily, operated incorrectly, and caused devastating nerve damage, and her life was permanently altered. And then there was the case that perhaps disturbed investigators more than any other, Jerry Summers.
Brace yourself, I'm sure.
Jerry Summers was not simply another patient. He was Chris's closest childhood friend. They'd gone to school together.
No.
And Summers trusted Chris completely. He believed he was placing his health in the hands of someone who cared about him personally. And in the Peacock series, what we see is they'd been mates at school and then they reconnected when Chris was at medical school and they spent a lot of time together. They were good friends. Jerry had a neck injury, I think, that had been created when he was playing football or something when he'd been in school, and it caused him pain always in his neck. And after the administration investigated, I think it was Kelly Martin's death, and Chris was like, oh, they're blaming me. It's not my fault. It was other people's fault, blah, blah, blah. So Jerry, believing that, was like, these people are out to get him. So he said, operate on me. Show how good you are. Like the fact that I trust you,
No.
And, yeah, and
Jerry,
some people did
Jesus.
try to
Don't
talk
do
him
that
out of it.
again.
But he went and he had his neck operated on. And during the operation, Chris severely damaged Jerry's vertebral artery and spinal cord. And he woke a quadriplegic. Now, there was a
That is
second.
well bad.
After the first surgery, he was able to move his right leg a little bit, his right foot a little bit. He had a tiny amount of movement. He was in a lot of pain, though. As I understand it, Chris got permission to do a second surgery on him, not so much from Jerry, but Jerry's grandmother. And so he put him into another surgery, and the intention was to release pressure on some nerves that he felt was creating the pain. And at the end of that, Jerry was a complete quadriplegic. And it was described in the retelling of the Peacock thing, the prosecutor says, what do you mean? And the professional doctor says, not Chris, Dr. Henderson says his head was barely connected to his neck. Like, he almost decapitated him, basically, and that's how he was a quadriplegic. So the psychological horror embedded in that case unsettled almost everyone who later examined the story because it challenged assumptions about motive and awareness. Chris was not only harming any anonymous strangers, he catastrophically injured someone who trusted him intimately. Investigators and observers struggled to understand what kind of psychological state allowed someone to continue operating after inflicting that level of destruction repeatedly. I mean, the woman who accidentally injured Kipling last year took herself off on sick leave and considered packing in her career as a vet. She was so horrified at the mistakes she'd made. And this guy's literally disabling and killing people and doesn't seem terribly bothered.
I'm not bothered.
Also, in some of these cases, he operated more than once on the person to do like corrective surgery and then just made...
It's like he's like, if you're going to do
Made
it,
it
do it well.
worse.
Got it. If I'm going to
just
finish
doubled
that job.
down. Yeah. I don't even understand how anyone could let a surgeon have a second go at you once they've botched you either.
That's what I don't understand. I know, right?
Unsurprisingly, as patient injuries accumulated, concern rapidly spread among hospital staff.
Good.
Nurses began documenting alarming experiences inside operating theatres. Anaesthesiologists questioned what they were witnessing. Fellow surgeons reviewed post-operative imaging and expressed disbelief. Some operations appeared less like surgical procedures and more like uncontrolled anatomical destruction. Basic structures were repeatedly mishandled. Procedures extended dangerously long while patients experienced severe blood loss or irreversible neurological injury. Two physicians eventually became central to exposing Chris. Robert Henderson, played by Alec Baldock in the Peacock series, and Randall Kirby, Christian Slater. Initially, both men encountered Chris professionally through hospitals where he operated. Over time, however, they became increasingly horrified by the pattern emerging around him. Henderson later reviewed imaging studies and operative reports linked to Chris's surgeries and concluded many appeared reckless and medically indefensible. Kirby similarly became convinced that Chris represented an extraordinary danger to patients. And they were right.
Is he doing it on purpose, Schmidty? No.
That's the question. What followed was a prolonged and deeply frustrating attempt to stop him. This is where this case exposes the systemic institutional failure built into the health system. No hospital wants to admit fault. Hospitals suspended him temporarily, but rather than aggressively reporting concerns and permanently revoking privileges, institutions often allowed him to resign quietly. Administrators appeared reluctant to escalate matters decisively. Concerns circulated privately while patients remained unaware. When pressure intensified at one hospital, Chris moved to another hospital. And because he didn't get fired, there was no record of malpractice, so new hospitals did their standard vetting and it came up with nothing and they hired him. He looked good.
Oh, my God.
The fragmented structure of the American healthcare system became one of the key reasons he was able to continue operating. Hospitals compete hospitals compete financially. Surgeons generate enormous revenue. Reporting systems between institutions are inconsistent. Administrators fear lawsuits, reputational damage, and liability exposure. Within that environment, a dangerous physician can continue practicing far longer than outsiders imagine possible. Christopher Duntsch repeatedly exploited those weaknesses. At Dallas Medical Center, events became even more alarming, if that's possible. Multiple witnesses later described operations descending into confusion and panic. Patients suffered catastrophic bleeding and severe neurological injury. Some staff reportedly questioned whether Chris was impaired during surgery because his behaviour seemed so erratic. One surgeon, who later entered an operating room after Chris had begun operating, reportedly found tissue destruction so extensive that he struggled to determine what procedure had even been attempted. Another doctor, reviewing one case, later remarked that the anatomy looked mangled. By this stage, some reviewing doctors began believing the issue extended beyond incompetence alone, Swanee, and was either intentional or he was a psychopath who genuinely could not recognise the extent of his own failures.
God.
And that distinction mattered enormously because ordinary malpractice usually involves isolated mistakes occurring within otherwise competent practice.
Mm-hmm.
The Duntsch case involved repeated catastrophic outcomes occurring over and over again, while the surgeon himself reportedly continued insisting he was highly skilled. Former colleagues later described him as possessing almost delusional levels of self-confidence. Even as patients emerged paralysed or dead, he blamed everyone else, hospitals, staff, colleagues, or circumstances, rather than acknowledging responsibility. Meanwhile, Alec Baldwin and Christian Slater, Henderson and Kirby, intensified efforts to stop him permanently. Working alongside the Texas Medical Board and law enforcement agencies, they began compiling evidence documenting the extraordinary scale of patient harm. And this whole thing took quite a toll on them personally as well. They were examining case after case involving catastrophic bodily destruction. Patients had entered surgery with manageable spinal conditions and woke up to being paralysed, permanently disabled, or they didn't wake up at all. Some operations were so disturbing that experienced surgeons reviewing them struggled to understand how basic anatomical principles had been violated so repeatedly. And so, while they were looking into him, they started to wonder how he'd even become licensed at all. Subsequent reporting suggested residency supervisors and institutions may have recognised concerns regarding his competency years earlier. Some accounts suggested he completed relatively few operative procedures during training. Others implied institutions were reluctant to formally fail or remove problematic trainees because of legal complications, administrative burdens, and reputational concerns. Medicine is intensely hierarchical. Residents depend almost entirely on supervisors for evaluations and future careers. And it's interesting, I know I'm talking about the American system, but this is some of the conversation I had with the nurse pre my surgery. It was around, I asked her, what's it like in the theatre? Because, there seems to be this hierarchy and the surgeon seems very powerful. I heard a lot of people refer to, in preparation for my surgeon, what the prof wanted, how the prof liked things, and the prof being my surgeon, he's a professor. Someone said, I better take those socks off. The prof doesn't like his patients having those socks on. It's things like that. Some poor nurse had put them on, then they were off, on, off. It's just people who work with these surgeons get to understand and work with their idiosyncrasies.
Yeah.
But I think...
And they're also very powerful. There's a dynamic in the operating theatre, a real power dynamic. Yeah.
You get that in, kitchens.
Yes, it's a chef-type mentality,
that
yes.
kind of...
Yes.
Yeah, but what I'm saying is that's not necessarily a bad thing until it is.
That's right. And I think when you've got a Christopher Duntsch as the surgeon telling everyone he knows what he's doing, I don't need you to tell me that. I'm aware of that. Thank you very much. I'm the surgeon here. Why don't you go fuck off? They do. And even other surgeons who aren't necessarily neurosurgeons, they're not necessarily spinal specialists, but they might be a vascular surgeon and they're helping because of they might have to open up a chest cavity or, there's something that their speciality is used for in that particular procedure. But they do know what it's supposed to look like. They've seen these procedures before.
Yeah.
And they were seeing him.
And they should know what's going wrong.
Well, they did. And they were seeing him do things and they're like, excuse me, doctor, you shouldn't, You don't need to do that. That's not, and he'd be like, shut up, this is right, as he's got a hammer and a chisel and he's knocking out a piece of vertebrae and then causing someone to, bleed to death. Yes, it's disturbing. Anyway, so going back to, I was talking about how medicine's very hierarchical. Residents depend almost entirely on supervisors for evaluations and future careers. And that, remember I talked about his supervisor was the guy who was also supervising him in the fellowship?
Yep.
Removing a trainee from a prestigious program is extraordinarily difficult. Institutions sometimes rationalise concerns or convince themselves struggling trainees will improve, and I think that probably was the case with him. Critics later argued that Christopher Duntsch represented the catastrophic endpoint of what can occur when those systems repeatedly fail. Eventually, the police became involved, which was extraordinary, as surgeons are rarely, if ever, criminally prosecuted. In fact, up until this case, never.
Wow.
For killing their patients. It's normally treated as a civil case of malpractice where spinal surgery is involved because even great surgeons lose patients.
Yeah.
Even competent surgeons, something goes wrong.
As in, when you say lose patients, do you mean they get frustrated?
They get very frustrated and then someone dies. No, they lose
both.
patience in the person on the table.
Right, yes.
Sometimes people die. The anaesthetic can kill you, like all sorts of complicating factors.
Yes.
We all sign the consent form after all, because no one wants to be sued and there's always a risk of death when you go under anaesthetic. The likelihood might be small, but there's still a risk. But prosecutors increasingly believe that Christopher Duntsch wasn't just a bad surgeon. In 2015, Duntsch was indicted on criminal charges related to patient injuries, including injury to an elderly person involving patient Mary Efford. Efford underwent spinal surgery in 2012 and emerged suffering catastrophic pain and permanent disability after he allegedly operated incorrectly and caused severe nerve damage. The prosecution argued Duntsch knowingly endangered patients through conduct so reckless it had become criminal. Jurors heard horrifying testimony from expert witnesses and former colleagues. Surgeons described operations violating fundamental surgical practices. Witnesses recounted excessive bleeding, severe tissue destruction, and baffling surgical decisions. And there was one case, I think it was one of his, almost might have even been his first, one of his early cases. He opened the guy up and he went to pull out a piece of his disc and he cut a piece of muscle. And he pulled it out and he looked at it and he said, oh, it's a tumour. He's got cancer. I can't do anything. Close him up.
Surely someone said it's not a tumour.
It's not a tumour. And he had at this point he'd shoved a sponge because he'd got a bit of bleeding and he shoved a sponge in the guy and he goes, oh, I can't do anything. He walked out and he said, just sew him up. And they sewed him up without removing the sponge. And about a week or so later, another doctor opened him up and cleaned it up and found it. And that man was, moments really from getting sepsis and dying because the infection was really bad. Yeah, that was one of his early operations. But it's just this sort of weirdness that he's just like, oh, it's a tumour. There wasn't a tumour. He just took the wrong piece of the man out.
God.
I mean, it's not ideal.
No, it's not ideal. That's what I was saying about baffling surgical decisions. I think that was my example of that. Some physicians testified that they had never encountered anything like it throughout their careers, and I should bloody hope not. They introduced text messages and emails in which he made disturbing statements suggesting instability, grandiosity, and detachment from reality. In one message, he referred to himself as becoming a cold-blooded killer. In others, and it's not quite the confessional as it sounds, but it was very much a grandiose email that he sent to he'd had a brief affair with she was sort of like his practice manager and she also assisted in surgeries. She was a surgeon herself or a doctor herself. And he had a very brief relationship with her and he sent her these emails. She was very affected because she could see that things weren't right either. In others, he discussed fantasies of power and domination. The messages reinforced the prosecution's portrayal of a man psychologically unravelled while continuing to perform high-risk spinal surgery on vulnerable patients. Now, I don't know if it's true or not, but they also very much inferred that he was on drugs, not necessarily while he was doing surgery, but he'd been taking drugs like the night before for some of these surgeries. The key question that the trial revolved around was at what point does catastrophic medical incompetence become criminal conduct? Basically, they had to show he was maiming and killing people on purpose rather than as a byproduct of being a really shit surgeon. The defence argued that he was just a really shit surgeon and in a crappy healthcare system. And the real problem was he hadn't got enough training. It wasn't his fault. He didn't get adequate training.
Got to
And
blame someone else.
well, I mean, you might say that when you've killed the first 3 people or you've hurt 3 people, but surely at some point you say, you know what, I don't think I'm very good at this.
Yeah.
3 out of 3 or 3 out of 4, that's not a good record. I need to not do this anymore. No.
2 out of 3 ain't bad.
The prosecution argued he was a physician who continued operating despite overwhelming evidence that he was catastrophically harming patients, and thankfully the jury agreed. In 2017, Christopher Duntsch was convicted and sentenced to life imprisonment.
Oh.
Yes.
The sentence was significant, because he's believed now, I think he was on charges of manslaughter and elder abuse.
Mm-hmm.
But as I say,
abuse.
The older lady.
The last customer, the last patient.
Customer.
That he operated on. He's believed to be the only doctor ever convicted for criminal charges associated with medical procedures.
Thank God.
Yeah.
You wouldn't want lots of those walking around.
No.
Not to say that it hasn't happened elsewhere, but,
Oh, it has, and it does. And that's, again, I think that's part of the interesting problem that this case raises, is that where you have a profession that self-regulates, i.e. a hospital will sack you or strike you off, and then you get disbarred kind of thing. The idea, we've always, and I must admit, I've never really given it that much thought, but last year a friend of mine died as a result of something that happened in a surgery.
Oh.
And that is going down the path of his partner is looking at suing, I believe, for malpractice. But there's not been any conversation about a criminal charge. And I don't know that there should be, but it's an interesting thing because, if I accidentally kill someone, it's manslaughter.
Yeah.
But if a doctor accidentally kills someone, it's unfortunate.
Whoops.
Whoops. And I might have an internal investigation that may or may not clear me, but, it's an interesting point about what constitutes murder or manslaughter, because surely accidentally killing a patient is manslaughter. Anyway, it hasn't been treated as such to date. But even manslaughter, there's no intent in manslaughter, right? But I think with the medical profession, they're saying, well, these people are sick in the first place, and these are high risk things, and so there is a risk, and it's all accepted that there's a risk, and so we'll do these surgeries, but you accept that there's a risk, and therefore manslaughter doesn't come into play. Do you see what I'm saying?
Yeah. I think it's very complicated, very complex, and it's not. Yeah, you're generally trying to help someone. Most people are generally trying to help someone.
Yes, and they made a big fuss about the Hippocratic Oath in the Peacock thing in the testimony that Dr. Henderson gave, if it is what he actually said, but he talked about the Hippocratic Oath and saying it's not just you won't do harm. There's other parts of the Hippocratic Oath that basically say you'll call it out if you see the wrong things happening, and a bunch of things that are in the Hippocratic Oath that weren't followed either, that were not specific to just him being a bad doctor. It was sort of about the system as well. And things that he should have done. Like, I think one of them is like, if you are shit, you don't keep doing it. And obviously I'm paraphrasing. Okay, so for victims and families, the conviction represented hang on, have I missed? No, I haven't. For victims and families, the conviction represented long overdue accountability. Yet no verdict could undo the devastation already inflicted. Patients remained paralysed, families had buried loved ones. Others continued living with chronic pain and disability resulting from surgeries they trusted would help them. There was one woman, he'd cut one of her vocal cords by accident, and it had affected her voice. She obviously got most of her voice back, but they said, how's it affected you? She goes, I can't sing. Not that I was a good singer to start with, but I can't sing. Yeah. This is all from someone that they trusted and surgeries that they thought would help them. To your point, Clark, you go into this because you're hoping for a fix or a cure. Now, if you want more detail on it, and this is for our listeners, because I haven't talked about all the cases, etc., there's a Wondery podcast on this called Dr. Death, which goes into a lot more detail. And, of course, the Peacock series by the same name, but it's 8 episodes, and you've got to bear in mind that some of it is fictionalised for the purposes of the storytelling. The question we should be asking, though, is whether there are sentences that we should consider doling out, whether to him and others. How did he get passed into practice in the first place if he only had 200 surgeries under his belt and had a bit of a drug problem? Why was he never sacked when he should have been?
Mm.
And limiting reputational damage was put before the safety of future patients. I mean, but it all comes down to limiting reputation, people just looking out for themselves and the institutions over the future patients. And we talk about institutions, but I often reflect on this in my own profession where we talk about the organisation, the business, the organisation. It's just a collection of people. It doesn't exist without the collection of people that run it.
Yeah.
So we use this word like the institution, like it's something outside of that collection of people, but it's not. And those people...
arguably, that's exactly what it is. And it's the culture that those people allow,
At
which
what
potentially
point...
they're all guilty.
That's right. And
Yeah.
at what point do you
So then no one is. That's the problem.
just take all your empathy and your humanity out of the discussion and become this institution as opposed to, well, yeah, I was an administrator and yes, that's very, they're almost desensitized to the point where it's like, well, that's unfortunate. Yes. Now, the portrayal of the woman from Baylor was that she was asking him she asked him a lot, what happened there, what happened there, what happened there. And that she eventually just said, you're not operating here ever again. I can't remember. It might have been Jerry Summers' case, actually, was the one that tipped her over the edge to say, go away. And then he went off to Dallas Medical Center. But Baylor didn't fire him. They said, you leave. I mean, we will fire you, but otherwise, it's better off if you just go. And there was a bit of posturing and he just left. She was portrayed in that show as quite strong and not taking any shit, but she still didn't report it. And when you don't report it, there's no evidence for Dallas Medical Center to look at. There's no way for them to understand what has just taken place. And so you're launching that guy onto the next lot of people, whether it's in your
100%
institution or not. Yes, so the case exposed uncomfortable truths about the business realities of healthcare in the USA. Taking a physician away and removing them creates legal and financial complications. Those pressures don't automatically create corruption, but they can produce hesitation precisely when decisive action becomes essential. And in this case, that hesitation became horrendous and catastrophic. And, you'd like to think that if a surgeon was really dangerous, the system would stop them immediately. But real people entered hospitals seeking relief from pain and lost everything. And families watched loved ones deteriorate after surgeries they believed would help them. Others spent years trying to understand how warning signs that later appeared obvious could have been ignored for so long. And these things, these catastrophic institutional failures don't really occur through one dramatic decision. They happen gradually. They're the sum of their parts. One concern is minimised. One administrator hesitates. One person assumes someone else will intervene. To your point earlier, Swanee, about the bystanders syndrome.
Yeah.
One dangerous person continuing forward because systems designed to stop them prove slower, weaker, and more fragmented than anyone imagined. Now, the positive of this story is that the two doctors did call it out. Henderson and Kirby went through all the correct professional channels to report him, and when the system failed to stop him, they went to the police, which was pretty much unheard of, right? And they had to try quite hard to get the DA to pay attention to them. Without their dogged determination, more people would have been victims of Duntsch. It's not really clear to me whether he really was intentionally going in to maim people and kill people.
Yeah.
I think he was just totally incompetent and was a bit of a psychopath who fundamentally believed that he was better than everyone else and it wasn't his fault. He's just unlucky. And he didn't seem to accept or acknowledge that he'd put hardware in the wrong place or cut the wrong ligament. None of those things were ever it was all something else or some other problem. Maybe the hardware itself was the problem or, he just found an excuse every time. And so I think that I had to chalk it up to an extraordinary delusion of competence on his behalf. And I couldn't see, there was no evidence that he got satisfaction from hurting anyone. There was nothing that said that he went home and, there's no sexual gratification about it. And he seemed slightly perturbed that his patients had died or went well or whatever, but it just wasn't his fault. It's just very unfortunate.
Oh, God.
And you know how people say the definition, even though it's not, of insanity is doing the same thing over and over, expecting a different result?
So that's dickheads.
So I think if you take that definition of insanity,
yes,
then I'd have to say he's insane.
He's insane. Yeah.
So what are your thoughts? That's pretty much the case. Yeah. And I didn't talk about he had stripper girlfriend that he got knocked up, and there was, and because he was doing the drugs, he's going to he's going to strip clubs, and I didn't really bring her into it, but yeah.
It's funny you say that. I was wondering about why is he doing it, and I was wondering if it's for the money, because you would get paid very good money, and that would facilitate a lifestyle that he's got outside of work.
At one point, he was on, I think they said around $600,000 a year.
Yeah,
in 2011, so it's a lot of money.
Yeah,
but
a lot of money.
When everything went to shit and they stopped him operating, he became effectively bankrupt in not very long period of time.
His defense, so to speak.
His defense attorney was a court-appointed attorney because he couldn't afford his own attorney, and he lost everything when he got charged. And I think actually before that, they basically had stopped him operating anywhere. And then it took a little while for them to actually, he'd gone off to, his parents lived in Denver, I think, and he'd gone off to see his father. And they portray his relationship with his parents in that he was always looking for validation from his father, kind of thing. And his father was portrayed as very Christian, and they were supportive of him, and they tried to help him, like they'd pay his bail and things like that. But well, they didn't bail him out in the end on this one, but he'd been doing things like shoplifting. He had a massive downfall, let's put it that way. And yes, I think he was doing drugs, and he was buying coke, and he was spending money, and he loved strip clubs. He went to the strip clubs with his mate Jerry.
Quite a lot. In a wheelchair.
No, before he did that to Jerry, before that happened. Well, pretty much, I think. I'm not quite sure how many surgeries between Jerry and his final surgery there were, but I'm going to suggest not that many before he finally got completely canned and disallowed all privileges at all hospitals. It also got to a point where no one wanted to work with him. He was so disgusting
Oddly.
in the operating theatre, and he was so rude to people, and he was such a megalomaniac kind of thing that no one wanted to work with him. And they saw him doing these terrible things. And that Dr. Christian Slater's character.
Dr. Christian Slater.
Dr. Christian Slater, what was his name? Kirby, I think. He talked about a time when he was in an operation with him, and he got called away. He wanted to stay, and I can't remember if that person died or was paralysed.
Kirby.
Of 38 operations, 33 people were permanently maimed or killed. 3 were killed and the rest were permanently maimed. So there might be 5 that didn't, sort of were lucky, and God knows what they were. But that doctor was called away, and he talked about kind of you could see that he felt guilty about it. You could see that he regretted that he didn't stop him. They basically said in an operating theatre, the surgeon's king, right? No one stops them.
And that's what I find quite interesting when you were talking about
even
that nobody wanted to work with him. I guarantee you that would not be something that happened overnight, because it would have been people at first going, oh, I'm not sure, that could have just been a bad one, or they wouldn't necessarily have all been in there together. So one person had a bad experience, not a whole group together, you know what I mean?
Yeah.
For the time for that to actually become a thing where they're like, no, and, having the power to say no would have been an unbelievably difficult thing to manifest in a hospital.
Well, and it was at Baylor, because there was one surgery that was delayed a week, and she said to him, how come it was delayed a week? And he said, oh, there was a problem with basically the support staff.
They weren't there.
They weren't available. And she said, they don't want to work with you, actually. So the hospital was aware of other people not wanting to work with him, but he kind of was like, oh, well, that's because I'm just good and they're jealous kind of thing. And, it was all that.
Of course it is.
To some degree, he convinced them along the way until eventually the administrator was like, no, hard no, you're a bullshit artist, I've had enough, you're out. But that, unfortunately, it took multiple people to be mangled by him or killed by him before they got to that. Yeah.
That's really hideous.
It's terrifying. And then the terrifying stat was that of the 3 leading causes of death in the US, get this, I can't believe it because you think about gun crime and stuff, but it's cancer, heart disease, and medical malpractice.
Far out.
So
I've got the first 2, but I wouldn't have thought.
Don't be going
That's
to
outrageous.
I think I can't remember, but I felt like the stat was like 1 in 10 people.
Seriously?
die or have a really bad time of it. Well, in
Oh,
his case, it was
God.
like
That's
That
terrifying.
sounds.
9.9 in 10, but
Oh,
yeah, but it was a terrifying statistic, yeah. And I wonder, the healthcare system, like it's very different to ours in terms of how it's funded. And I don't know enough about it. I should have done more research on it. But, like I know Obamacare came in, which was to bring in health insurance a bit like ours, I think. Because there were times that people couldn't get any help at all. They couldn't afford any kind of medical support. But it just makes you wonder, like these people are doing 8 years of study and a residency to come out and not be able to do the job.
there's probably a couple of, it's like for some doctors who are competent, but also perhaps having incidents during surgery, there's the hours that they work, the constant pressure they're under. There's the fact that people are always different. So, there's not necessarily, it's not a factory. You're not necessarily doing the same thing every time. There can be variations. They're kind of in my mind, the reasons that things could go wrong when everyone's got the best interest at heart.
But don't you think wouldn't those stresses and those things be the same here?
No. What I'm saying is, so in medicine in general, there are reasons
Okay.
why things could go wrong.
Oh, yeah.
That are when everybody has the best intention and is doing
Absolutely.
more or less what you would expect them to do.
And is competent.
Sometimes, but sometimes there might be bad luck involved in that, but it isn't necessarily malpractice.
Absolutely.
But malpractice, like when you go bowling and you get 10 strikes in a row, you've got to be very good at that. So for him to have 10 malpractice cases in a row is quite remarkable. And for everybody to stand by and allow that to happen, even more so.
In fairness to Dr. Henderson and Kirby, they tried really hard. They picked it up relatively soon, I think. It was like his third or fourth case. But I think Dr. Henderson was at the Dallas Medical Center. So he might have noticed it at the Dallas Medical Center, and no one at Baylor or whatever it was called, Baylor. No one there had, like the administrator got rid of him in the end.
But I'm not talking about the people who did notice it. I'm saying that, so if you go in and do 10 surgeries in a row in either hospital and they're all a dud,
you shouldn't be.
Who's sitting there going?
Surgeries, 4 surgeries.
No,
like
but I'm using the analogy of the strike, right? Where you get 10 strikes going bowling.
Yeah.
That's like everyone goes, wow, you're amazing. And you might bowl every weekend. If you do surgeries every week and you have 10 in a row that go wrong, there's got to be alarm bells going off from the institution. And it's
absolutely
it kind of reeks of the pedophiles in the church. There's a little bit of that where they pass them around and hide it and keep it all under
reputational
wraps.
Damage. Yeah. It's very much about minimizing reputational damage.
So we have a thing in safety at work, and it's chain of responsibility. So if someone's doing the wrong thing and nobody does anything, then it sort of goes up, and everybody's got a role in safety. And so recently I've had to sack a couple of people for doing unsafe things on the back of
operating on people and
repeated offence. Well, like potentials for road accidents, or actually severely injuring or if not killing somebody by what they're doing at work. Yep. And I always justify it by, if you're not getting any better at this, 100%. So I say to people, if they're doing it time and time again, at some point you're either a danger to yourself or to other people, and that's when I'm going to have to remove you. So one of them had a whole lot of stuff going on. There'd been talk of him committing suicide, and I'd had to go through all of that over a long period of time. Anyway, he did something and it was the last straw. I'm like, that's it, you're gone. And he didn't, I guess my point, because people are going, my God, he's going through all this sort of stuff. And I'm like, at some point he's got to go, you know what? I'm going through all this stuff.
I
can't keep doing something that is going to put everybody else at risk.
Yeah. But it's about your capacity to do your job, right? So because you're
but what I'm saying is, in terms of the self-awareness, to go, I'm either able to or not able to. This bloke, the surgeon, Chris, could have said, I'm not very good at this, I'll get out. But if he's not going to make that decision, somebody above him has to pretty quickly.
Yep.
That's the bit where I go,
Agreed.
God, how? So if two doctors come to you and go, this bloke's a danger to the patients, who's sitting there going, oh, we better just,
You're just
have
jealous.
a review of that. Yeah. Like what?
Oh, now that I'm looking at the 10 strikes, but you're just jealous.
They reported him to the Texas Medical Board.
Who could then say, let's stand him down while we look into this?
They did.
Or could just
They
go.
did. But they did exactly that.
But then how
and
long
then
did that take?
Couple of weeks. They decided they believed his bullshit about, no, it was this, that, the other. And they're like, okay. And they let him start up again.
But I think that's possibly where it sits then. Because at some point you go, how far do you go? And I don't know where it is because you don't really get enough detail of it all. But somebody should have removed him way sooner. Because you could say, well, tell us about the times where it worked. What do you normally do? There's no times where it worked. I actually haven't performed one of these surgeries successfully.
I think the other thing that's interesting, because Dr. Henderson definitely did, they were doing peer reviews. So I think the part of the system or part of the way
Alec or Christian?
Managing it, Alec.
Right.
They do these peer reviews. And he actually, I think he operated on a patient that had been maimed by Duntsch.
Yep.
And he was horrified. He's like, what was he doing? My God. And I think it was off the bat of that he then maybe pulled some previous cases and started to do a bit of a review of the work. And that was sort of what started him on this. This guy's really bad. And then he rang up Kirby, Christian Slater, and said, have you worked with this guy? And, what do you know, kind of thing, or vice versa. Anyway, they hooked up with each other as people who were working in the same sort of circuit. And both of them had significant concerns about the capacity and capability. And they did report it. But it's a question, I think, also about, we've talked before about failings in the police force where databases aren't shared and you've got federal cases and you've got state cases and and in England we have, different counties and they're not all on the centralised thing. I think there's an element of that as well that plays in here is, as I was saying about the self-regulation of the medical fraternity and the medical system. Who's reviewing for the cases where people, the outcome was a poor outcome? Poor outcomes, what's the review process? Where's the objective? Taken away from necessarily the hospital that doesn't want the reputational damage and put into some kind of third party that says, hang on a minute, there's a pattern here. There's 3 people in a week pulling S right away.
The data shows this.
And I don't know the answer to that if it exists, So, I was quite happy for him to get a life sentence because 33 people got a life sentence.
Yeah.
Gotcha. Yeah.
Yeah, and, that's the least he could do, frankly. And I just think there needs to be a significant overhaul of the healthcare system and the reporting capability, to your point, Paul, so that people can, regardless of whether or not you're $1 million surgeon, you can be stopped if you've lost your edge or you've become, what did they say it was, an impaired physician?
Position, yeah.
That's not just like, for sure we'll put you in a program, but and I know a lot of money is invested in them to get them there as well. There's a lot of cost involved in training these people and getting them there, but there's got to be a better way to protect the patient.
Yeah, you could even level something at the university for allowing to do 200 surgeries when he should have done 1,000.
Yeah.
That's malpractice lecturing, teaching.
I suspect what happened there was that his supervisor and the university thought he was going to go and be a researcher. They didn't really think that he was going to go. But they allowed him the piece of paper that let him go off and do it.
It doesn't matter what they thought. They're giving him qualifications that he shouldn't have.
Yes, that's right. I agree.
Wankers.
There you go.
They're all just a bunch of cocksuckers, to quote Muriel's wedding. No, was it Muriel's wedding?
Well, I think it's a bit of that because
it was.
It's all the chasing the next Viagra, I guess, or, chasing the next medical breakthrough that will put their name on the map as well, or that will get them the Karolinska Institute Nobel Prize for Medicine or whatever, like that sort of stuff. There's sort of this, both in the university side of it and the research side of it, and then also in the practice, just all very highfalutin people thinking they're above a lot of things. And this guy just thought he was above everything. Yeah.
So maybe as sentence, he also needs to share a cell with, was it Eom In Suk, who was stabbing people in the eye. Oops, I did it
Yes,
again.
yes.
He could do with a little bit of...
Did you like that I called it Oops, I Did It Again, did you?
Yeah. A bit of anatomical... did I? I didn't tell you. I meant to tell you. So I got a text message from the friend who recommended that. And did I tell you that, or did I
No,
forget to?
you forgot
She
to.
said, "Oops, I did it again. Love the title of the episode. You did an awesome job with the story. Truly bonkers. I still can't understand how she got away with poking so many eyeballs."
Oh, it was awful, yes.
I think those two could have they could share a
Share
cell
a
together,
cell.
and he could just
Yeah.
keep waking up with really sore eyes. Like,
Oh,
what happened?
well, it certainly would stop him practicing ever again. Yeah, no, just awful. All right, Swanee, you got anything?
I found that it's really hard to listen to that story. I
Yeah, it was
think that
awful.
the thought
I
of
agree.
so many people going in with such great pain and such high hopes, and then to be mutilated and come out worse, if not dead. And it's that thing of like you honestly think that, we have this discussion, or have had this discussion in our own home many, many times. They're just people. Surgeons are just people. They're humans,
Yeah.
and yet we tend to
Yeah.
elevate them, and because we want to believe that, right? I think a lot of it's got to do with I'm really putting my life in their hands. So a part of it is kind of like suspending the belief that they
I
are
have to
human, they are
believe they're
superhuman.
Yeah.
So we do that because it helps us deal with the circumstances that we're going to put ourselves into. It's still, weighing up there, just humans who do good things and bad things and whatever else, but it's so much a part of what we project onto them because we need to believe that to get us through these
Absolutely.
terrible, terrible things. But that's why I just feel so bad for these people and their families who thought that they were going to find an outcome that was going to be better than their existing, life. And they end up just, God, it's macabre to think that he was doing all that stuff. It's really gross.
Yep,
With
it
such
sure is.
haphazard. I really am quite speechless. And you know what? I've seen Dr. Death so many times, and every time I've thought of doing it, I think, I don't think I can cope with that. And I didn't even know as it was bad as it was, but I just thought, I don't know if I can deal with that. And I know why it is. It's because I don't want to not believe that they're going to solve my problems and they're going to do it in the best way possible and they're going to be amazing. Because clearly there are so many people who are incredible who save lives. I mean, we know that.
Oh, there are, yeah.
But here we go. Dr. Death disproves that, and on a level we just can't deal with.
He's a massive dud surgeon, but, to Clarkie's point, twice. You get one pass out and then you've done it wrong twice, you're out. Like you're going back to school, mate. Like the fact that he went on and on and on for 2 years is extraordinary.
No, I don't think anyone, we do expect them to be brilliant and perfect, but we sign the waiver because we think we understand there has to be risks associated with it. We understand that things can happen. But, when it's constantly happening and then everyone's just, I'm not looking. We're looking over here so that doesn't come back to us. Everybody was sort of like.
Us covering.
Yeah, let's just,
this is awkward.
we weren't watching.
Awkward.
Oh, well, there was no more on our watch after that happened. But, what happens after that's not, oh, God, that's terrifying because that is all about accountability and ass covering and doctors don't say they're wrong.
There does need to be an element of peer review. Yeah, that's true.
The peer review is one thing, but there's got to be a power associated to the peer review that can stop you from continuing. And that seemed to not be there. So these doctors knew that he was doing the wrong thing. They kept reporting, trying to find the threshold where someone would go, oh, enough, stop, we'll pull it. Mm-hmm. And just didn't seem to be able to, until they went to the police. And the police sat on it, by the way, for ages because as far as they were concerned, they don't do medical prosecution. It's not a thing. And it was just this, I think she was an assistant DA and her name was something Shergert, and she picked it up and she was quite dogged.
Haggett.
No, it wasn't Mariska Hargitay. Mariska Hargitay didn't do it, but it was a girl called Shergert was her name. And she was quite dogged as well in her building the case against him in the prosecution. And that's what stopped it in the end, which was, thank God for that. But I think for him, because he's just got this psychological thing where he can't see that he doesn't appear to be able to see that he's made a mistake and it's him. I want to reverse that. I want to put him in a situation where you tweak that part of his brain so that the scales are removed from his eyes and he all of a sudden can see all of the mistakes he's made and that they are his mistakes and that he hasn't, like we talk about Swanee's math nightmare of her not being able to do the maths and not
I just have to
putting
own
any
up to it,
billing
right?
in.
Yeah.
Let's put him in that nightmare where he's actually seeing what he's doing and he knows it's wrong. He knows it's him. And he has to live with the fear, with what that has done. He has to really live with that.
Yeah.
He cannot get away with the rest of his life in jail being deluded, thinking he didn't do anything wrong.
Yeah.
He has to know and
I like
sit
that.
with what he's done. I think
that's
that's for
good.
me.
I think that's really
Because
good.
the idea that he's still out there somewhere thinking, it wasn't me. I've been
Yes,
wrongfully
I like that
prosecuted.
idea. The fact that he's forced to relive each and every one of them and every error is obvious and people are there saying to him what's wrong and he's,
And he knows.
humiliated and humbled by the experience. Can't imagine he would be, but yeah, would it be nice to
Oh,
think
that
that
was
it would
you.
happen? Yeah.
Crushing. I think it would be really because a normal person would be devastated by one, let alone 38 or 34. Or
Maybe he
33.
could be looking at, like an American, I don't think you really see it in Australian TV or movies, although I may have missed it. You know how there's always a scene where they're all standing in a glass room that looks down onto the surgery?
Yes.
When they're looking, maybe in his sort of, cell, what he sees is everybody looking at each and every operation, saying all the errors that he'd done and just how badly, every single procedure and technically how it was incorrect, negligent, all of the things that it was, every single one, and all of these important people watching and everybody. So he just sees it constantly, just how much he fucked up.
I read somewhere the only time he started to recognise that maybe he did make some mistakes was in his trial, because the surgeons, a bunch of, expert witnesses, came forth and talked about what the procedure should have looked like and what should have happened versus what happened when he did it.
Okay.
And I read someone say that it
was the only thing that possibly stopped him.
At that point, he
gave
started
him pause.
to go,
yeah.
Oh, hang on,
That's
maybe I wasn't perfect. But I'm not, I didn't see it for myself.
No.
And therefore, that's my punishment for him.
Yes.
Clarky?
You know those, Swanee, those shows they have, what you were talking about, where they're all looking through the glass thing, but it's, the top 40 worst blah, blah, blah of all time.
Yeah.
It could be the top 40 worst spinal malpractice operations of all time, and he's got 38 of them.
Yeah,
and
correct.
There's a whole comical thing around it. Oh, my God, you wouldn't believe it. And
no. How bad this guy
coming
being.
in at 29, it's Christopher Duntsch again.
And 28, it's him again.
Oh, my. And you wouldn't believe it, 27, Christopher Duntsch. Yeah. Extraordinary.
Is that what they would be suggesting using, like in a university hospital? Do you reckon that would be the setup? Potentially those American
observation.
Yeah. I've not seen anything with one of those in it for a while, actually, because I haven't watched anything that would be remotely like that because I can't go. But I do remember that those scenes where people are sort of looking down onto the theatre.
I know what you're talking about. I admit I haven't seen it for a while either, but yeah, I know what you mean. All right. Well.
Great story.
Thank you for joining me for
story.
that. Terrible
Great.
story.
Terrible.
Absolutely appalling. But I'm glad I did that after my surgery, though, I must admit.
Oh, God.
Yeah.
I'm glad Alex's teeth were out last week. I wouldn't have coped. I was like, I don't want anyone going anywhere near procedure for a while.
I'm pleased that I didn't know the ins and outs of that. She did tell me that he was just chronically incompetent, and I was like, what? And that was sort of as far as the conversation went, but she told me about Dr. Death, and that's
now do we just go into everybody we've got to have to do anything for a scan? Now, just hear me out. I've had a bad experience where I've been exposed to the work of Dr. Death, and I've just got a couple of questions for you. How many hospitals have you worked at?
How many people have you killed?
You get the idea.
Tell me about a time where you successfully performed this operation.
Yeah.
I like the way you spun that. Nice. Yeah. Goodness me. All right. Well, thank you for joining me on that. And as we say every week, miss you already.
Ciao.
Ciao, ciao.
Thanks for listening to Trial by Wine. You can contact us at trialbywine@gmail.com. Please rate, review and subscribe to Trial by Wine on Apple Podcasts or wherever you get your podcasts. If you'd like to support us, you can become a patron at www.patreon.com, Trial by Wine, or visit our website www.trialbywine.com to donate to us. Your support will help us cover many more cases and apply wacky sentences. We really appreciate you listening and hope you tell everyone about us. Our cover art is by John Christo and music is by Beauchamp from pixabay.com.